Can fatty liver be reversed in 1 month? Can it be cured? You have probably seen a lot of videos promising detox drinks, miracle juices, powders, various fancy diets that claim to get rid of fatty liver in 30 days. As a gastroenterologist, let me be very clear. Fatty liver doesn't magically disappear in 1 month, but the accumulation of fat, the inflammation in the liver can significantly be reversed within 1 month if you do the right things. In this video, I will explain what is actually possible in 30 days, what is a myth, what truly works based on science. Please do subscribe to this educational channel for more science-based videos. Fatty liver means excess of fat getting stored in the liver cells. This is happening because of a couple of reasons. One, there is insulin resistance. So our body starts to respond differently to the insulin hormone. Secondly, you might be consuming more calories, more carbs, sugar that you're intaking regularly, which is all getting stored as fat. Thirdly, there is not much movement, so leading a kind of a lazy sedentary lifestyle. Some people, they're also consuming alcohol. So as a result of excess of carbs, high calories, lifestyle, possibly some indulgence in alcohol, all of this now starts to overload the liver. So the liver is getting a bit overwhelmed and starts to get irritated, inflamed. It's not able to do its job properly. The good news is fatty liver is one of the most reversible liver conditions, especially if we can detect it at an earlier stage. Now, let me clear the biggest myth. Fatty liver is not going to be cured by these miracle juices, detox drinks, powders of some kind of home remedies. It is not going to work just by drinking lemon water, by drinking apple cider vinegar, and there are no juice cleansers or herbal powders that is going to remove fat out of the liver. There is no scientific evidence. So, in fact, a lot of these detox drinks, what people are consuming can worsen the fatty liver because some of them have actually higher amount of sugar and very little protein. So when people ask me, doctor, can my fatty liver be really cured in 1 month? My honest answer is yes. You can significantly reduce the fat in the liver within 30 days. You can certainly see an improvement in the liver enzymes, the SGOT, SGPT, the AST, ALT levels, what you can see in the blood test, if you were to recheck it and see. If you were to ask me, can we reduce the inflammation in the liver? Definitely yes, and thereby also reduce further scarring and damage in the liver. You can certainly feel more energetic as the changes of fatty liver is getting reversed within a month. This is not a miracle. This is more of a metabolic correction. So in order to reverse fatty liver, there are a few things that are compulsory and science is very clear on this. First and most important one is the weight reduction. Even as low as 5% of reduction in your total body weight can significantly reduce the fat inside the liver. Let us say you weigh about 100 kilos. 3 to 5 kgs, even within 2 to 3 months, as long as you maintain the consistency, discipline. I don't advise my patients go on crash dieting because it is dangerous. It can actually cause a damage to the liver further. As a gastroenterologist, what I suggest is slow but steady fat loss, and that's what helps heal the liver properly. Second important aspect is the protein intake. Many of our Indian diets have got high amounts of carbohydrates and the amount of protein consumption is not always great. Low protein intake can actually worsen fatty liver. Protein helps to reduce fat in the liver. It preserves the muscle. It improves the metabolism. Your body needs to spend more energy to burn protein compared to the carbs. If you are serious about reversing fatty liver, you should have good source of protein. If you are a vegetarian, you can take lentils, legumes, tofu, paneer, mushrooms, soya. For non-vegetarians, wide variety of options including eggs, fish, chicken that is not fried. I would not advise taking red meat. Protein is not optional in terms of treating fatty liver. Protein itself can become medicine. So when consuming more protein, You match with adequate amount of fiber as well, because I see a lot of people taking higher amount of protein and then they start to feel constipated, bloating, feeling uncomfortable because they are starting to get a little bit constipated. So good amount of water, which is also going to reduce the load on the kidneys, good amount of fiber that is required along with protein to reduce the load on the gut, and so that you can have a smooth bowel movement. And so high protein diets should accompany water and fiber as well. The third important thing is what to quit immediately. If you really want to reverse fatty liver within a month, stop sweets, sugary drinks, fruit juices. These have all got high amount of sugar. So cut out refined carbohydrates, maida, various bakery products. You need to get rid of late night eating. The later you eat in the night, it's going to be difficult to lose the weight and hard to get rid of the fat in the liver. And also stop frequently snacking. If you want to munch between the meals, have some cucumbers, carrots, a bowl of fruit. Most importantly, in this 1 month, where you're really trying to get the fatty liver under control, quit alcohol completely. Even social drinking in that 1 month period can delay the recovery of your liver. Alcohol along with fatty liver is one of the fastest ways to actually accelerate the liver damage. Last but one of the most important aspects of improving fatty liver is by physical activity. Everyone knows exercise is good. You do not need to go and do extreme workouts. Scientific studies have shown time and time again that just 30-40 minutes of brisk walking, at least 5 days in a week, is enough to improve the fat in the liver, reduce that insulin resistance. If you get time, you can add a little bit more of strength training, resistance training on top of cardio. It's very important to maintain consistency if you're serious about fatty liver reversal, not just doing intense workout for 1-2 days and then leaving it out for a couple of weeks. One of the most ignored aspects of liver health is sleep. Sleep is fundamental to gut health as well as the liver health. Your liver is repairing and resetting mainly at night. Poor sleep means it's worsening your fatty liver. People who don't sleep in the night also end up consuming unwanted late night snacks. Try and aim for good 7 hours of sleep. Have an early dinner by 8 p.m. if you can. Try and have a fixed sleep schedule. I understand some people are working different shifts. This can disrupt their body's what we call as the circadian rhythm. If you are committed to fixing your fatty liver within a month, then you really need to have a regular sleep schedule. Late night dinners, late night being awake can disrupt that cycle of the repair that occurs in the liver. People quite often ask me about medicine supplements to speed up the process of this fatty liver reversal. As a gastroenterologist, let me be very clear. There is no magic tablet that can cure fatty liver. Some people do need medicines. Why? Because we need to improve their insulin resistance. We might need to improve their cholesterol, triglyceride level. We need to improve their sugar levels, diabetes, their blood pressure, because they're all part of this metabolic syndrome. If you do not improve these, then you're not going to improve and reverse the fatty liver. In some people, yes, we do sometimes give simple medicines, simple antioxidants like vitamin E, omega-3, glutathione, but 80% of fatty liver treatment comes purely by lifestyle correction. Now comes the question, how do you know that your liver has actually improved in this 1 month, what I mentioned? Firstly, don't depend on symptoms, because liver is the last organ in the body to give you symptoms. By the time symptoms start, we know that the liver damage has already been significant. So track your weight. Also see what is your waist circumference. If your waist size is going down, your belt size is going down, your weight is going down, that is fantastic, because there will be definitely improvement of reduction of fat in the liver. Recheck the blood test, the liver function test, the SGOT, SGPT. You can see a drop in these liver enzymes. We can do a follow-up ultrasound scan, or sometimes follow up with a fibroscan to exactly measure the amount of fat steatosis, what we call as the CAP score, CAP score. So this can tell us the reduction in the fat, reduction in the liver injury. Many can see their improvement in just within 4 weeks, and because they feel more energetic, which is a very good marker of liver improvement. Some people do have other complicated medical history, including they might have heart disease, diabetes, which may not be well controlled, significant obesity, high cholesterol, very high liver enzyme. So medical guidance from gastroenterologist, of course, is required in such people. Fatty liver is reversible, but advanced disease will require specialist guidance. It's not going to be cured by doing some shortcuts. It is reversed by correcting the metabolism. Just 1 month of disciplined lifestyle can completely change the direction of travel as far as your liver health is concerned. You need to look after the liver because it is an organ that works silently to keep us alive. Please do follow Bangalore Gastro Center Hospital for science-based liver and gut health videos. Thank you.